Hello, my name is Tasha, and I'm here to bring awareness to this often misdiagnosed as well as misunderstood disorder. The disorder I'm talking about is body dysmorphic disorder. Before I get into that, let me go into the history of body dysmorphic disorder. BDD was first described by an Italian psychiatrist, Enrico Morselli, as dysmorphobia in 1891. The term was derived from the word dysmorphic, a Greek word meaning mishapness or ugliness. Dysmorphic first appeared in the histories of Herodotus, referring to the myth of the ugliest girl in Sparta. The next major historical reference of dysmorphobia was by the French psychiatrist Pierre Janet, who described a woman who was housebound for 5 years. He considered this diagnosis to be part of an obsessive compulsive neurosis, which he described as obsession de la honte du corps, which means obsessions of shame of the body. Now, what is body dysmorphic disorder? According to the Body Dysmorphic Disorder Foundation, BDD is characterized by a preoccupation with one or more perceived defects or flaws in appearance, usually unnoticeable to others, yet magnified to the sufferer. In reality, the perceived defect may only be a slight imperfection, but to someone with BDD, the flaw is so significant and prominent that it often causes severe emotional distress or difficulties in daily functioning. Now, how are people with BDD emotionally affected? Body dysmorphic disorder affects 1 out of 50 people. BDD is just as common as OCD and more common than other disorders such as anorexia nervosa and schizophrenia. The impact of body dysmorphic disorder on a person's quality of life is going to be significant and in some cases can become severe. Some individuals end up with lives so limited that they effectively become housebound, constantly obsessing over their appearances for hours up to an entire day, making it difficult for them to focus on anything other than their imperfections. In fact, many who suffer are either single or divorced, which suggests they may find it difficult to form or maintain relationships. The kinds of emotional distress BDD can cause include anxiety, shame, disgust, and depression. Potential causes of BDD, according to mirrormirror.org, they're unclear, although certain factors seem to increase the risk of developing or triggering BDD, such as blood relatives who suffer with BDD or OCD, negative life experiences such as bullying or trauma, personality traits like perfectionism, societal pressure or expectation of beauty, having other psychiatric disorders like anxiety, social depression, OCD, and eating disorders. MGHOCD.org lists other variations of BDD, such as BDD by proxy, which is when the sufferer experiences impairment in their daily lives due to intrusive concerns about another person's appearance. The person of concern may be a family member, such as a spouse, child, parent, or sibling, partner, friend, or stranger. Individuals with BDD by proxy may spend excessive time scrutinizing the other person's appearance or comparing themselves to others. They may also engage in behaviors to try to improve the other person's flaws, suggesting surgery or makeovers. Then you have muscle dysmorphia. Eating disorders have stereotypically always been linked to females, but there is a form of eating disorder that affects primarily men called muscle dysmorphia, identified as pathological obsession with muscle building and extreme dieting, sometimes referred to as bigorexia or reverse anorexia. Men who suffer from muscle dysmorphia narrow the focus of their lives to the goal of developing the perfect body. Now, according to Anxiety and Depression Association of America, or ADAA, there is diagnosis and treatment. Even though it is often misdiagnosed as one of the these disorders due to the fact that they share similar symptoms. The intrusive thoughts and repetitive behaviors exhibited in BDD are similar to the obsessions and compulsions of OCD. The avoidance of social situations is similar to the behavior of those with social anxiety disorder. In order to get an accurate diagnosis to receive appropriate treatment, people must mention specifically their concerns with their appearance when talking to a doctor or a mental health professional. There is cognitive behavior therapy or CBT, which teaches patients how to recognize irrational thoughts as well as how to change negative patterns. Although there are no medications specifically approved by the FDA to treat this condition, medications used to treat other mental disorders such as depression can be effective. Successfully used medications are in the SSRI class of antidepressants, and some of those antidepressants are Celexa, Lovox, Lexapro, Lovox CR, Prozac, paroxetine Paxil, Zoloft, or Paxil CR. Now, Oxygen.com gave me a list of celebrities that suffer with BDD, such as Miley Cyrus, Brittany Snow, Robert Pattinson, Sarah Michelle Gellar, Uma Thurman, Andy Warhol, Michael Jackson, Lily Allen, Marilyn Monroe, Shakira, Demi Lovato, and Jamie Lynn Sigler. I do have some pictures. Show them to y'all. This is what the person with BDD would see themselves in the mirror. As you can see, she has a nice swimsuit body, but according to her eyes, that's what she sees. And this is what a man suffering with bigorexia would look like. And here's the two psychiatrists that I mentioned that first diagnosed BDD. And that's all I have about body dysmorphic disorder. If you know anybody who suffers from low self-esteem, pay attention and make sure it's nothing more. But thank you for listening and watching. Let me pan out to my audience. And have a good night.